With a strong focus on education and technology improvements, the Medicine Hat Emergency Department is starting to deal with more trauma patients. Trauma Medical Director Dr. Paul Park says the Medicine Hat Regional Hospital has seen more trauma each year, and they are able to keep these patients locally, where in the past they would send them to Calgary. Dr. Park says Medicine Hat is a Level 3 trauma center and takes referrals from surrounding areas.
See lots of traumas come from places like Oyen, even Western Saskatchewan, Bow Island, all of these community places, even Brooks will feed, their major traumas will come to us now. And then we'll definitively optimize them, use some of our resources like CT imaging and our OR, and then the thing that's evolving there is even then a lot of times we would send those patients to Calgary after we've stabilized them. Now we're keeping more and more of them in our hospital and dealing with them definitively.
But he says trauma isn't just about what happens in the emergency room.
From injury prevention, pre-hospital, emerge, the operating room, hospital to rehab, that whole cycle is a massive team-based approach. So there's a lot of working components in the trauma program.
To help educate physicians, nurses, and EMS staff about dealing with these cases, the STARS mobile simulation bus travels to different centers and is a bus set up like an emergency room.
We've got a high-fidelity mannequin that talks, he breathes. You can start IVs on him, you can do all sorts of medical things to him, and all the equipment that the nurses and doctors may need are all within the room. So we'll present this mannequin as a sick patient. The nurses and doctors within the community will have to come in, try to figure out what's wrong with him, and try to make him better, hopefully.
Allison says a lot of these cases presented in these sessions are based on real-life scenarios. He feels the mobile simulator has many benefits.
Physicians within the group don't have to travel to the bigger cities to get that further education. As well, they get to work within their own groups. So they get to work with their nurses from their hospital, as well as possibly their EMS staff. And they get to, hopefully it helps with their communication skills. We can work on things like that, as well as cases they may not see for years or months. We can present that to them throughout the day and build a sort of muscle memory, I guess, as you could say. And so when that person does walk through the door who's really sick, they've seen it before and they have a little bit more confidence in dealing with that patient.
For more information on the STARS education programs, you can visit www.stars.ca. For Go on Shaw TV, I'm Leanne Evans.